Smith.
Thank you, Madam Chair. I'd like to ask a question of Dr. Walensky, if I could. I think we all know that Americans need better access to rapid testing, and this is a big deal for us in terms of trying to figure out what are our health risks, how do we protect ourselves, and how do we also go about our lives. And I think that we are making headway here, that we have a long way to go. Dr. Walensky, I'd like you to talk about this issue of how we should be or not collecting and analyzing the data from rapid home tests. Should we be incorporating this data into, should we be trying to capture that data? Is this important for local communities as they're trying to make decisions about masking and other public health strategies that they want to deploy? Should we be thinking of the data from rapid tests as a tool for individual risk assessment or as an important tool for population level understanding of what's happening? How do you see that?
Yeah, thank you so much, Senator Smith. So we have been using the PCR test, not the rapid tests, the lab tests, the molecular tests, to really capture our case counts and really get a good view of where we are in terms of the epidemiology, anticipating what was going to be coming into the hospitals. But the self-tests are a really important, valuable tool for people to empower themselves, their own health, to not expose themselves to other people, to get some information about their own health. And so if an individual were to test positive, if they're feeling unwell, they should certainly consult with a healthcare provider, consult with a pharmacist and your health department. But if you're feeling well, then use that rapid test to say, okay, my test was positive, I need to stay home and isolate, protect myself from the community, protect myself, or the community from me, and protect me, my loved ones so that they don't get infected themselves. And I think that it's less about the absolute case count of understanding whether you have asymptomatic infection or a runny nose and your rapid test is positive than it is really about empowering you to do the right thing and not be forward transmitting.
And could you talk a little bit about what other countries are doing? Are other countries in trying to incorporate this rapid testing data into their population metrics? How is that working in other places around the world?
Some countries are and some countries aren't. London and UK have been doing more reporting of rapid testing, but they too are saying that they're missing, I think, somewhere around 40%. I'd have to confirm that number, but they too, while they capture more than we have tried to, they also agree that they're missing some as well.
Okay, thank you very much. Madam Chair, I'm going to cede back the rest of my time. I just want to acknowledge something I think has been going on here today that I think just deserves being called out. Dr. Fauci has been the target of a concerted and coordinated campaign of disinformation and distortion and personal attacks. And then he's being blamed for all of this hatred and anger that has been generated against him. And I mean, I think we just need to be honest here that this is being done by some members of the Republican Party that are using it for fundraising. I'm not saying that that's happening by members of this, I'm just saying that that's happening. I was just pointed out to me that somebody sent out earlier this, in 2021, a Fauci for prison email. So I just think it's important that I have to call this out. And I think it's important that we see it, and we have to try to rise above this kind of behavior. Our committee here should be focusing on these kinds of nitty-gritty policy questions, and we're not always going to agree. I've never heard Dr. Fauci or Dr. Walensky, for that matter, declare themselves to be invincible. I certainly am not. But that should not mean that individuals, career public servants, are subjected to this kind of abuse. Thank you, Madam Chair.
Thank you. Senator Collins.